Welcome to today's video. Did you know that some common medications can harm your kidneys? In this video, we will reveal surprising information about 10 popular medications that may be linked to the development of kidney failure. Let's find out what these medications are, understand the associated risks, and explore safer treatment options for various health conditions. Don't miss out, because the 9th medication is the most dangerous, and many people use it without knowing. You will be surprised. Let's get started right now. 1. Non-steroidal anti-inflammatory. Non-steroidal anti-inflammatory medications, NSAIDs, such as ibuprofen and naproxen, are commonly used to reduce pain and inflammation. However, their use can pose serious risks to kidney health, especially when used long-term or in individuals with underlying conditions like chronic kidney disease, CKD, or diabetes. NSAIDs can lead to acute kidney injury, AKI, a condition where kidney function suddenly decreases, potentially leading to a buildup of toxins in the body. In severe cases, this can result in complete kidney failure, necessitating dialysis or a kidney transplant to sustain life. AKI often occurs because NSAIDs inhibit the production of prostaglandins, which help maintain adequate blood flow to the kidneys. Moreover, NSAIDs can cause direct damage to kidney tissues, including acute tubular necrosis and acute interstitial nephritis, which can be irreversible if not treated promptly. Long-term use of NSAIDs has also been linked to worsening chronic kidney disease, accelerating the decline of renal function, especially in patients with pre-existing kidney damage. People with comorbid conditions like heart failure, cirrhosis, or those taking other medications that reduce kidney function are at particularly high risk of kidney damage from NSAIDs. Healthcare providers recommend that individuals at high risk, such as the elderly or those with underlying health conditions, use NSAIDs cautiously, opting for the lowest effective dose for the shortest possible duration. Regular monitoring of kidney function during treatment is advised to detect early signs of kidney damage. Alternative pain management strategies, such as using acetaminophen or non-pharmacological treatments, may be safer options, helping to reduce the risk of adverse effects on the kidneys. 2. ACE inhibitors and ARBs. Angiotensin-converting enzyme, ACE, inhibitors and angiotensin II receptor blockers, ARBs, are commonly used medications for treating high blood pressure and heart failure. Although these medications provide significant benefits in controlling blood pressure and reducing cardiovascular risks, recent research has indicated potential harm to the kidneys with long-term use. Specifically, studies have shown that renin-producing cells in the kidneys can undergo abnormal changes under the influence of these medications, leading to the hardening and thickening of kidney blood vessels. This condition can reduce blood flow and result in kidney damage. Elderly individuals and those with pre-existing conditions like chronic kidney disease or heart failure are particularly at risk. While ACE inhibitors and ARBs are still recommended due to their overall cardiovascular benefits, it is crucial to monitor kidney function and potassium levels in patients taking these medications. Further research is needed to understand the long-term effects and to develop strategies to protect kidney health while maintaining effective treatment for cardiovascular diseases. If you found this video helpful, please like and subscribe for more important health information. 3. Diuretics. Diuretics, commonly known as water pills, are often used to treat conditions like high blood pressure and edema. They work by prompting the kidneys to remove excess salt and water from the body through urine, helping to reduce blood pressure and decrease fluid retention. However, improper or prolonged use of diuretics can lead to significant health risks, particularly concerning kidney function. One major risk associated with diuretics is dehydration and electrolyte imbalance. These medications can deplete essential minerals like potassium, leading to symptoms such as muscle weakness, cramps, and, in severe cases, irregular heart rhythms. This is especially dangerous for elderly individuals and those with underlying cardiovascular or renal conditions. Long-term use of diuretics, particularly loop diuretics like furosemide and bumetanide, can increase the risk of chronic kidney disease progression and end-stage renal disease, ESRD. Studies have shown that in severe cases, diuretics can exacerbate pre-existing chronic kidney disease, accelerating the decline in kidney function. Other side effects of diuretics include headaches, dizziness, diarrhea, and nausea. Some diuretics can cause frequent urination, increasing the risk of dehydration if fluid intake is not adequately maintained. 4. Antibiotics. Some antibiotics, particularly aminoglycosides and vancomycin, are known for their potential to cause kidney damage. Aminoglycosides, such as gentamicin and tobramycin, can accumulate in kidney cells, leading to inflammation and tissue necrosis. This risk is especially high in older patients, those with pre-existing kidney dysfunction, or those receiving high doses and prolonged treatments. Vancomycin, commonly used to treat infections caused by methicillin-resistant Staphylococcus aureus, MRSA, can also lead to kidney toxicity, a condition known as vancomycin nephrotoxicity, VNT. VNT occurs when high levels of vancomycin in the blood cause the formation of vancomycin casts in the kidney tubules, leading to inflammation and damage to kidney cells. The risk factors include high doses, prolonged use, and pre-existing health conditions such as kidney disease or diabetes. The mechanisms of nephrotoxicity for aminoglycosides and vancomycin involve the production of reactive oxygen species and inflammatory responses, which damage the tubular cells in the kidneys. Monitoring blood drug levels and kidney function during treatment, especially in high-risk patients, is crucial. Adjusting the dosage, duration of use, and considering less nephrotoxic alternatives are important measures to minimize kidney damage. 5. Proton pump inhibitors. Proton pump inhibitors, PPIs, such as omeprazole and esomeprazole, are widely used to treat stomach conditions like acid reflux and ulcers. However, recent studies have linked long-term use of PPIs to an increased risk of chronic kidney disease, CKD, and end-stage renal disease, ESRD. A study published in Advances in Therapy indicates that PPIs may cause inflammation or damage to kidney cells. This damage could be due to the reduction in stomach acid production, which allows bacteria to grow in the gastrointestinal tract, potentially leading to acute interstitial nephritis, a form of kidney inflammation. Another study in the pharmaceutical journal highlights that patients using PPIs have a higher risk of developing CKD compared to those using other medications like histamine H2 receptor antagonists, H2RAs. The misuse of PPIs, especially long-term use without medical indication, can increase the risk of kidney damage and other side effects, such as Clostridium difficile infection and osteoporosis. These side effects not only affect the kidneys but also include gastrointestinal disturbances like abdominal pain, diarrhea, constipation, nausea, and vomiting. To minimize these risks, experts recommend using PPIs at the prescribed dosage and duration, with regular monitoring of kidney function. 6. Lithium. Lithium is a common medication used to treat bipolar disorder and other mood disorders. However, long-term use of lithium can cause various forms of kidney damage, including both acute and chronic kidney diseases. Chronic kidney disease, CKD. Long-term lithium use has been linked to the development of chronic kidney disease. This is particularly evident as kidney function gradually declines over time. Studies have shown that patients on lithium therapy have a higher risk of developing CKD, including advanced stages, CKD stage 3 or higher, compared to those using other mood stabilizers. Nephrogenic diabetes insipidus, NDI. This condition, where the kidneys are unable to concentrate urine, is another common issue associated with lithium use. NDI leads to symptoms such as excessive urination, polyuria, and excessive thirst, polydipsia. These symptoms can progress to more severe dehydration and electrolyte imbalances. Other renal issues. Lithium can also cause acute kidney damage. In some cases, it can lead to the formation of kidney cysts. The risk of these conditions increases with the duration of lithium use. This risk is influenced by factors such as age, pre-existing kidney issues, and concurrent use of other nephrotoxic medications. To mitigate the risks of kidney damage, regular monitoring of kidney function and lithium levels in the blood is essential. It is recommended to aim for lower lithium blood levels, 0.6 to 0.8 milliequivalent/L, to minimize nephrotoxic effects. Additionally, annual testing of serum creatinine levels is advised to detect early signs of kidney impairment. 7. Chemotherapy medications. Some chemotherapy medications can cause kidney damage either through direct toxicity or by inducing dehydration. These medications are commonly used to treat various cancers, but they can pose significant risks to kidney health if not carefully managed. Cisplatin-induced nephrotoxicity, CIN. Cisplatin is a widely used chemotherapy medication known for its high potential to cause kidney damage. It can lead to acute kidney injury, AKI, especially when used in high doses or over extended periods. The mechanism of damage typically involves the accumulation of cisplatin in kidney tubular cells, leading to inflammation and cellular injury. Risk factors include older age, concurrent use of other nephrotoxic agents such as aminoglycosides, and pre-existing conditions like hypertension or diabetes. Impact of dehydration. Dehydration is a common issue during chemotherapy and can exacerbate the risk of kidney damage. Some chemotherapy medications can impair the body's ability to retain fluids, leading to dehydration and increased kidney toxicity. Dehydration and electrolyte imbalances heighten the risk of tubular cell damage and other complications. Regular monitoring of kidney function and hydration status is crucial during chemotherapy treatment. It is important to frequently check kidney function markers, including serum creatinine levels and glomerular filtration rate, GFR, to detect early signs of kidney damage. Maintaining fluid and electrolyte balance, including proper hydration and electrolyte supplementation, can help reduce the risk of kidney damage from chemotherapy medications. 8. Herbal supplements. Some herbal supplements, especially those containing aristolochic acid, can cause serious kidney damage. Aristolochic acid, found in plants like Aristolochia and Asarum, has been linked to chronic kidney disease, CKD, and aristolochic acid nephropathy, AAN. This condition can lead to severe kidney failure, potentially progressing to end-stage renal disease, ESRD, and increases the risk of urinary tract cancers. Aristolochic acid can cause inflammation and necrosis in kidney tubular cells, reducing kidney function. AAN often results from using herbal products containing this compound, sometimes sold as traditional medicines without proper regulation. These effects usually appear after prolonged use, leading to the accumulation of aristolochic acid in the body and subsequent toxic reactions. Using products containing aristolochic acid not only causes kidney damage but is also associated with various cancers, including upper urinary tract cancers, such as in the kidneys and ureters. Research indicates that individuals with kidney damage due to aristolochic acid have a higher risk of developing cancer in these organs. Always consult with a doctor or healthcare professional before starting any herbal therapy, particularly if there is a history of kidney disease or other health conditions. 9. Opioid painkillers. Opioid painkillers, including morphine and oxycodone, can cause kidney damage through various mechanisms. This is especially true when these medications are used in high doses or over extended periods. Toxin accumulation and kidney failure. In cases of reduced kidney function, the body's ability to excrete the drug decreases. This reduction leads to the accumulation of opioids in the body, increasing the risk of opioid toxicity. Such accumulation can also cause damage to kidney cells, potentially leading to acute kidney injury, AKI. Reduced blood pressure and kidney blood flow. Opioids can significantly lower blood pressure, especially at high doses. This reduction in blood pressure can decrease blood flow to the kidneys, causing ischemic injury to kidney tissues. Prolonged reduced blood flow may contribute to the development of chronic kidney disease, CKD. Increased nephrotoxicity risk. Some opioids can increase the risk of kidney damage. This risk is heightened when combined with factors such as dehydration or the concurrent use of other nephrotoxins. Patients with underlying kidney disease are particularly vulnerable to this increased risk of kidney cell damage. 10. Statins. Statins, widely prescribed to lower blood cholesterol levels and prevent cardiovascular diseases, are generally considered safe. However, there are concerns about their potential to cause kidney damage, especially in elderly individuals or those with pre-existing kidney conditions. Acute kidney injury, AKI studies have shown that using statins, particularly at high doses, can increase the risk of acute kidney injury, AKI. This risk is more pronounced in elderly individuals and those with pre-existing kidney disease. One study reported a 34% increase in the risk of hospitalization for AKI within 120 days of starting high-dose statins compared to low-dose statins. Another analysis indicated that the number needed to harm NNH for an additional case of AKI was 593 for women and 447 for men over 5 years. Chronic kidney disease, CKD. While statins are often prescribed to patients with chronic kidney disease, CKD, to manage cholesterol levels, there is some debate about their impact on kidney function. Some studies suggest that starting statins in patients with type 2 diabetes and CKD may reduce the risk of developing diabetic kidney disease and declining kidney function. We've explored 10 common medications that can harm the kidneys. From nonsteroidal anti-inflammatory medications, certain antibiotics and diuretics, each can negatively impact kidney function if not used properly. Understanding this information is crucial for protecting your kidney health. Always consult with your doctor or pharmacist if you're taking any of these medications to ensure they don't harm your kidneys. Sometimes, adjusting dosages or switching medications can better protect your kidneys. If you found this video helpful, please like and subscribe for more important health information. Share the video with friends and family to help protect kidney health together. Thank you for watching, and see you in the next video.